With Christmas 1 week away, despite warnings, a lot of families are still planning to gather, a lot of them relying on getting tested for COVID. But is that really reliable, and how difficult it is getting a test these days? Well, NBC News' investigative and consumer correspondent Vicky Nguyen is going to take a closer look at the state of testing and how to avoid a surprise bill.
Long lines and waits that can take hours.
I just waited in line for about an hour and 20 minutes.
As millions of Americans flock to get COVID-19 tests, now a new surge in testing demand with Christmas just days away. Despite warnings not to travel,
people are going to do it regardless. And so if you do, let's be as safe as we can.
Dr. Rahul Kara, an emergency room doctor, owns urgent care clinics and testing centers in the Chicago area. He says getting a COVID test before seeing loved ones doesn't guarantee safety, but it can lessen your risk of spreading the virus.
People think if I get a negative test, it's a free pass. I can go, I can hang out, I don't have to wear a mask, I don't have to socially distance. What do you say to that?
Having a negative test, any negative test, is not a free pass. It just tells you that at that moment, they did not find any virus in your nasopharynx or your nasal cavity. But it's important to know that as long as you are negative, please wear your mask, please socially distance.
Currently headed out to go get a COVID test, so let's see how long the lines are, how long the wait will be.
NBC News producers all over the country, from California to Florida, headed out to see what it's like to get a test.
Today, it is a very long line.
In New Jersey, so far, it's easy at this urgent care clinic.
No wait, no appointment, just come on in.
In Southwest Florida, the lines are a bit longer at this state-run testing site.
Usually there's a line of cars all the way onto the street. Not today, but there's still about a half-hour wait.
But across the country, at another public health testing site in Los Angeles,
This is the line to get into the COVID test site. It's all the way under the freeway.
and in Dallas at this urgent care clinic, be prepared to wait a while.
It's a minimum of 3 hours right now.
Despite long wait times in almost every region we checked, results were available within minutes, but they came with a hefty price tag. These private testing centers often charge hundreds of dollars. At this testing center in Florida,
Really no wait, 3 to 4 hours to get your results, but it costs $125 out of pocket.
our same producer found even pricier tests in New York City.
Today I had an appointment. It took just 8 minutes. But you have to be willing to shell out some money. This appointment costs $250.
Healthcare experts say if you have insurance, all COVID tests, rapid or PCR, are covered, and there should never be any out-of-pocket costs. But if you go to a lab or clinic that's out of network, like the ones where we got quick results, or if you don't have insurance, you could pay hundreds of dollars for one test. An insurance industry trade group found that 1 in 6 out-of-network COVID tests cost in excess of $400.
And that's why it's so important to check with your health insurance provider, make sure where you're getting tested is part of your insurance network.
To avoid getting a surprise bill before getting the test, check with your insurance to verify the doctor, lab, or clinic are in network. If you don't have insurance, look for a public health testing site. The lines may be longer, but the tests are always free. While experts say staying home is safest, if you choose to travel, try to quarantine as long as you can before the visit and for at least 5 days once you return, and consider getting another test. Tips to reduce your COVID risk while trying to get home for the holidays. Vicky Nguyen, NBC News.
Vicky, thanks so much. And something to keep in mind, the PCR test is actually considered the gold standard. It can detect the lowest levels of virus in the body, but those results can take a couple of days.